All right, Nish, welcome to the Ownerships podcast. I'm excited to get this going. Thank you so much for jumping on. So tell us about the origin story of Ventari VR. How did this all become about? And yeah, please share with us.
Yeah, cool. Thanks, Ryan. Thanks for having me today. My name's Nish. It's short for a very long Sri Lankan name that I won't bore you with or the audience. But my background is I'm a surgeon. Spent about 10 years in healthcare back in Australia. I'm now based in Seattle. But really, the story of Vantari, which I co founded back in 2017, was really a almost a embryonic evolution of what I saw in healthcare. So Vantari, just for those who don't know what it's about, is basically like the flight simulator for healthcare. So we help physicians, nurses, students practice life-saving procedures in a safe, scalable way, i.e. virtual reality headset, before they do it on patients. And really the company's motto and vision is to help eliminate medical error. Why is that? It's because when I was practicing, and a lot of physicians and doctors around the world will probably tell you that the gold standard of training is still very, very subjective in see one, do one, teach one, which means, let's say, Ryan, you are my professor. I'll get to, basically see you do a procedure today in the operating theater or bedside, and you'll say, hey, Nish, watch me how I do it. These are the 10 steps, for example. And the very next day, I'd get a patient that comes through the ER or the operating theater, and I'd be told, you can do it. Now, let's imagine, Ryan, if that was your family member, your brother, sister, your parents, whoever it may be that was getting that procedure done by me. Would you really let me touch you if you knew that I'd never really done one and only ever seen one? And the sad reality is that's just how healthcare is done because the best way to learn is, still practicing on patients, which shouldn't be the case because I know if I had someone touching me that had never done one, I know that the level of mistakes or the rate of mistakes would be much higher. So that was the first red flag for me when I was practicing medicine. The second big red flag, which is it's not quite a flag, but it's more that it has limitations, is the gold standard of how we train besides subjective techniques is we use mannequins and we use cadavers. Now, cadavers are difficult to access. You can imagine that there's only a finite resource of them, and you have to preserve them. And mannequins, which can be extremely helpful for certain degrees, are also, in a way, not replicable of real life scenarios or complications. You're talking about plastic dummies here that don't look like you or me, Ryan, or look like any of the audience listening today. And really, the way we utilize it is, if I'm practicing on a dummy, I just use the previous puncture site that someone else has made, and hey, I've done the procedure. So it has limitations and it can't replicate what you see in real life. Now, the reason I started Vantari, and this is close to my heart, and this is a story I'll share today, is that when we train using those two techniques. Now, you don't know from the minute you train when you'll get to do that procedure on a patient. So, when I was training in Australia through the College of Surgeons, there was a 2-year wait list for workshops. And these workshops are simulation workshops where they organize dummies, they have supervisors, lecturers, and you do a 2-day workshop where you get to learn, real procedures that you may get to do the next week, or you may need to do in 5 or 10 years. You just don't know. Now, this particular workshop was a trauma workshop. So I signed up, and 2 years later, I got my calling. I went for a weekend to a place called Canberra, which is down south from where I was living in Sydney. And when I trained, it was an extremely invaluable course, but I actually got to train a procedure called the surgical airway, which is a cut in the neck to help you breathe in a life threatening situation. Now, this particular procedure is something that you'd hardly ever have to do in real life. Maybe you've seen it in movies where someone has to do it in a plane, but
Yeah.
it's something that you don't have to really do very often. So we actually trained on sheep models. So we had live sheep on ventilators and we practiced. And you can imagine this is a long time ago, but enough that animal ethics have sort of moved us away from using live sheep and we're just using dummies now. But
Wow.
that's what I trained. And 2 days later, or should I say after the course, they gave me a certificate saying you're good to go, you passed the course, and you're good to do this procedure. Now, 4 years later, so fast forward, I was at a country hospital, which I won't say the name of to save their grace, but at this hospital, it was around 10 o'clock at night, and there's only two doctors on site. So there's a doctor in the ER, which is the emergency department, and there's myself. And at 10 o'clock, I'm thinking, it's been a nice night. I'm finishing off. I'm going to head home. And I get a
Nice and
call,
quiet.
which is always a win if you can leave home at 10 o'clock as a physician. But, I get a call from the ER and they say, look, we've got a patient who's come in. They can't breathe. We can't intubate them, which is basically put a tube down their throat to help them breathe. Really need you to come down and do a surgical airway. And I'm thinking, I haven't done one for like 4 years. Now, I didn't say this aloud, but in my head, it's just like, going crazy in that I haven't done one in 4 years. I last did it on a sheep and I'm expected to go to a patient 4 years later. So, you
Oh my
know,
god.
you can imagine the level of stress and anxiety at this point, which a lot of doctors have to go through as a rite of passage almost. But it's sad when there's a patient on the other line, right? We're dealing with finance or economics. We're talking about patient lives, and that's a huge thing. So, the best thing I could do at that point was call my attending or my professor, which a lot of us do. And, he he picked up the phone and he said, look, I'm 20 minutes away. Like I'll start driving, but I can't be there in time. The best I can do is talk you through the phone and send you a YouTube video to refresh your memory. And, it's the 2000s and we're using YouTube videos, plastic dummies, and we're using subjective techniques to train. Like, there's just got to be a better way. So anyway, I ran down to the ER. I was highly stressed out. I watched this YouTube video, which refreshed my memory. And, I did this procedure, and you can imagine with all the sirens going off and people yelling and all the rest, that it left a huge like mark on me, and how I then went on to do Vantari. But essentially, that procedure went okay, and the patient survived, and it was a blessing. But it left me with a whole level of PTSD and a burning desire to want to do something.
I could only imagine. Oh my gosh.
Yeah.
That's, I feel like that's like, most people's worst nightmares, having to do something like that, and you just feel like, to your point, right? You probably felt when you first did it on the sheep, you're like, "Okay, I think if I had to do this the very next day in real life on a real person, then I'd probably be okay." But you said there was what was the lapse in time?
Yeah, it was about like 4 years for me, but there's a lot of data to show that you de-skill within a month or 2 months and so on. So just the curve keeps getting worse. And, from that point, it was only a few years later where I sat down and I was looking at, and this is just to tie your part up with the question, is like, I was looking at our pilots trained in aviation, and they have to do thousands of hours in a simulator before they fly a plane. And, you and I and no one listening is going to jump on a plane if we knew the pilot hadn't flown one, right? Like, so what makes you think it's okay to go to a hospital and get a procedure done by a doctor who's never really done one? Like, that shouldn't be the case. And we need a better way to do things. So I really took that as an inspiration to co-found the company with another doctor. And so that's kind of the inception story in a way.
That's amazing. Man, and I'm assuming there's plenty of doctors, like you said, it's almost a rite of passage to have that feeling that you did, and I'm sure every doctor and every surgeon has their own story that happened, right?
Yeah.
Um, in a similar fashion. So, man, but you guys actually took action. So instead of everybody that kind of was like, "Well, this is all part of the learning curve and this is just normal," it sounds like you guys are absolutely bridging the gap and trying to make a difference. Um, awesome, man. Well, thank you for that intro. That was awesome. I want to talk about kind of like the core problem here, which you kind of already hit the nail on the head, but I want to elaborate. So, when you look at hospitals, medical schools, clinical training programs today, like what other than the obvious, like what are some of the other biggest pain points um, from the standpoint of preparing surgeons, preparing doctors for like real life scenarios?
Yeah. So it's a really good question, Ryan. And like you said, a lot of doctors, if you talk to them, will have a story that stands out to them and what kind of made or break them in some way or form. But I'd say like a lot of people don't know this, but medical error is the third leading cause of death globally. And so what people often think kills people is, cancer and heart disease, which is fair. Those are the top two causes. But medical error is the third leading cause of death in the US and globally. And a lot of it is preventable, right? It relates to medication error, like people just writing the wrong dose or wrong name for the drug that's delivered, all the way to um, complications from procedures. And so, where we wanted to make an impact at Vantari is around, almost every day there's a procedure being done in any site around the world. And we wanted a safer way to train that person and give them the ultimate skills and toolkit so that they can perform at their best. And so, if something like that can prevent one mistake a day, you're already going to see a huge impact and curve movement in the way that we are basically teaching the next generation of doctors, but also on the other side, the patient outcomes, where on average, when you make a mistake on a patient, they have to stay in hospital for an extra 3 to 5 days, Ryan, which means that there's extra health economic costs because obviously there's more staff and medications, but also a huge cost in that the patient's life. Like, let's just say you have to go to ICU. You don't know the kind of risks that come from that, from infection, from breathing, and all the rest. So, there's a huge cost there, both from the patient side, but the healthcare side as well. So right now, people have seen lots of ways of trying to bridge that gap, which is you've seen mannequins get better, they're more high fidelity, right? Like you've seen them start to have all the bells and whistles that they can almost speak to you. There's like voice boxes in these mannequins that they can interact with you, which is kind of cool. But you know, I think in the end, you still need to access a particular site or a flagship center that has these resources, right? Let's just say, you're at one of the 6,000 hospitals around the US. Not every hospital is going to have access to that high fidelity mannequin equipment, nor are you going to have like setups such as like Stanford, where they have this amazing lab and they're able to like generate an entire scenario in an operating theater. And that's great. But like, let's just say you're at a peripheral site and you don't have any of that. How do you practice? How do you maintain your skills? How do you make sure that when you're doing a procedure tomorrow that you're not going to make a mistake? Now, you can't prevent all mistakes. Like I may make a mistake, Ryan, because I'm tired. I've worked 80 hours and this is my last procedure of the day, in which case I probably shouldn't be doing it. But, like there are lots of reasons, right, why someone makes a mistake. But ultimately, it's known that better training makes better clinicians and better personnel to deliver care. So, if virtual reality can bridge the gap and democratize healthcare training, no matter where you are, then we've done our job, right? Like, I always wanted to try and make an impact beyond treating one patient at a time. And this is a way that we can impact healthcare as a whole. So, yeah, at the moment, people are introducing new modalities to train, new like web based solutions to train. But I think procedures is one of those things that's really difficult until virtual reality has started to come into play. So, yeah.
So impressive. Are there any other players in the space from the standpoint of competition? I mean, obviously, what you guys are doing is fascinating. Can
Yeah.
you elaborate a little bit on that?
Yeah, that's a good question. I mean, definitely, there's lots of people who are out there making an impact in their own way and trying to move healthcare in the right direction. And honestly, like we wouldn't be here without them either, because everyone is paving a way to ensure that virtual reality is seen not just as something for gaming and entertainment, but something that can make a difference in a very important domain, right, of what we call healthcare and patient care. So I'd say when you think about virtual reality, for those that aren't super comfortable, it's literally we're talking about head mounted displays. So you're in a virtual reality headset. So you might have gone through a shopping center or a game arcade where you have had to put one on and go through a roller coaster, which isn't my favorite solution because you get quite sick and nauseous. But I
Oh,
can guarantee guarantee that healthcare is not the same. But in essence, that's what I'm talking about here. So when you use virtual reality, you can use it all the way from the patient angle to the physician angle. And I'm just going to give you a context so that I can explain to you the providers and people that are out there making a difference. So you can use it for instance, patient education, like understanding your condition better. Maybe you get a chance to go through your own scan in 3D, for example. Maybe it's that you need to get a injection at the general at your family medical site. You need to get immunization. Well, I'm really scared. I've got a needle phobia. Well, actually, virtual reality can distract you and help you, and it can be basically seen as a solution to help you deal with your needle phobia. So we've seen it from patient education to phobias to even in the procedural side, which is where we said there's honestly probably 100 plus specialties of medicine and subspecialties, right? no one provider can do it all. That's why in medical device land, you can see there's, hundreds of medical device companies. I mean, there's the big ones, the Medtronics, the J&Js, the Boston Scientifics, but you still have hundreds of people trying to make a difference. And so what we decided is we're going to carve out our focus areas, which is what we call the golden triangle of medicine, which is essentially emergency medicine, intensive care, and anesthesia. And the reason for that is, Ryan and people listening, is that one third of all healthcare personnel work in those three domains, and one third of all healthcare resource utilization is in those three domains. So that means every time you're entering the hospital, you'll get a chance to see an emergency physician. If you get sick, you have to go to ICU, and if you have to go to operating theater, you have to deal with anesthesia. So that's where the triangle came in for us, and we really wanted to focus on that, and we did it really well. The other players that we see in the market are really focused on more high volume procedural medicine like orthopedics. So there's companies like Osso, Precision, who do it really well. Hip replacements, knee replacements. That's not our bread and butter. Um, and then we see, people doing general surgery, ophthalmology, so eyes, cataract surgery. So with fundamental VR, we see people doing scenario-based training, so like soft skills. So, for example, Ryan, even though you're getting a procedure done, I have to learn how to interact with you. Maybe break some bad news to you, saying, "Hey, Ryan, I'm sorry, but you're going to need a procedure." If you're dealing with those sort of soft skills, there's solutions for that as well. So there's Oxford Medical Simulation. There's also people who are doing multiplayer in one scenario. Let's say you're running an arrest or a trauma, and you have to say, "Hey, to my colleague, can you get me that medication? We need to administer it now." Okay, you're going to do CPR. So there's solutions like Simex. So everyone is basically plugging a hole in medicine to help improve that area of training. And so what we're seeing is there is a bit of coalescence happening as the technology is maturing, as the healthcare market is maturing, as more and more users are using it, in that we've started off in those golden triangle, but because our technology was quite good and quite in demand, then cardiology wanted to use it, as you can imagine, because there's a lot of pacemakers and defibrillators and catheters out there. They're like, well, we need the same solution to train. So, yeah, I would say that's kind of where we're at. But we're seeing that more and more. It's not that I'm going to a hospital teaching them what VR is anymore. They're like, oh, we're kind of using it for phobia training or distraction or even rehab when they have to get out of bed. I can give it to my patient and it'll get them moving. So that way, it's not a VR education. It's, hey, you're already using VR. Let's help you reduce the medical error side with what we do. Yeah.
Wow, that's so good. Okay. And I think I'm laughing on my questionnaire. You just covered like 3 things in a row. So that
Sorry.
was so good. No, that was perfect. Give me 1 second. I wanna see what the next topic is I wanna bring
You're
up
good.
here. Um, I'm very impressed, man. This is really awesome.
No worries. I'm trying to help as much as I can.
All right, so we got that covered. Okay, talk to me about let's see here. So you shared that story. What about so if there are some healthcare leaders that still think VR sounds futuristic, expensive, or kind of the nice to have type of scenario, what are the most common objections that you hear and how do you address them? And I know you just said we're not in the you guys are not in a space or a time period now where it's like, oh yeah, VR doesn't work. Oh, that's too futuristic, or like, hey, it's not there yet for us. I think like you said, it's becoming more widely adopted, but you guys are very niche specific on exactly what you guys are bringing to the table. Tell me a little bit about some of the day-to-day pushback that you guys still are getting, if any, and then how do you guys address that? What are some ways to get past the hurdle?
Yeah. So that's a really good question, Ryan, because if everyone believed in VR, it would be in every home and in every hospital, and we'd be using it, yesterday, today, and tomorrow. So it's not like the whole world is convinced. And part of that is our education piece, but also because, virtual reality as a whole has been quite overhyped, if I'm being honest, right? Like you look back to 2014, where Oculus, which is the most predominant headset in the market, there's HTC, there's a bunch, Microsoft HoloLens, there's a bunch of other ones, but most part, Oculus owns about 53% of the market or just above that. And so they're still a dominant player. But Oculus got acquired by Meta, which was Facebook at the time in 2014. So everyone thought, oh, the metaverse is here. We're going to have avatars interacting with each other, and you know, what does our digital world look like? And in a way, it was taking us too far down the future without taking us on the building blocks to get there. Right? It's the simplest analogy or comparison I could do is, Ryan, you've got a phone. Every human's got a phone, right? Like, and if you don't, then you're in an area without no reception. So that's a different story. But if you've got a phone and you've got a smartphone, it's only as good as the apps that are on it. Okay. So content then becomes king. And I think where um, virtual reality often struggled in the past, and I'll cover where it is now in healthcare, is that the content was just related to gaming and entertainment. But what's the difference between watching a movie in your virtual reality headset and watching it on a screen? So people were like, well, where's the actual value propositions of this, right? Outside of gaming and then maybe some 3D movies. And so, where we've seen it in healthcare evolve is with this piece, right? People are starting to see, hey, it actually can be scalable. It's also more cost effective, Ryan. When it came out, it was thousands of dollars. It needed multiple sensors in the room and, it needed heavy internet connection. It was clunky. Where it is now, it's like, under $500 for a headset and you can do so much with it with great processing power. So it's much more
Wow.
powerful. So there's like that macro factor, or should I say the headset factor, that's evolving
Hmm.
with the GPU, with the cost price point, with more content base. On the healthcare side, we still get pushback, but that pushback is becoming less and less only because more and more institutions are incorporating it and becoming almost like centers of excellence or flagship sites for others to follow. Let's just say, Ryan, you're the head of a department at a hospital and you don't actually know how to use it, how to
Hmm.
start, embedding it. What are the outcomes? The easiest part is I always say to my team and to Vantari, we are not our biggest sales force. Our biggest like Salesforce or like voice of customer is literally all of our partners. They just refer us to each other. They teach each other. They set up consortiums to educate each other, run research. So I think that's breaking down the barriers. But I would say there's probably, let me just think of like three top barriers right now that we get pushback on. So one is one is I've seen all virtual reality. It's all crap. It's a waste of my time. And I'll tell you now because that's what I heard from Harvard, Beth Israel, when we pitched to them. And when we presented to the chief of anesthesia, there or cardiac anesthesia, that's what he said. And we said, look, can you just give us 10 minutes? Just pop the headset on. Trust me, you really like this. And we've spent a long time. And it's a physician founded company. So we're like, we really took care of how it's done in VR. So when he used it, he was like, it was like, this is the best thing I've ever seen.
No.
I didn't realize we could even do this in VR. So that's one of the big pushbacks in that I don't think people quite realize what good VR looks like versus bad VR. Because you go to the shopping center, you use a roller coaster application, it's clunky, it might make you feel sick, and you're like, you know what, VR is not for me. It just makes me feel sick, nausea, it's expensive, whatever. So there's the first barrier in that there's a preconceived notion based on what you may have seen or experienced. Two is, I think people are now seeing virtual reality as almost like a threat to what is already being done, right? So let's say the providers that are doing mannequins and sim workshops, and that's their day to day kind of prerogative to push that. They're trying to figure out, does VR replace that, or am I out of a job because I can't cover as much as I used to? And part of the education is that VR doesn't solve everything, right? It can do a number of things, but still, like, it's a tool for a solution that we all want to get to, which is better training, better practitioners, better patient outcomes. Now, if you can see it as an adjunct and use it in the right way, which is, and a lot of our health systems use it in this way, in that it's a hybrid system. So let's say, Ryan, you're a new doctor, you've never learned a procedure, you get told at one of the health systems that we work with saying, hey, Ryan, you need to learn a procedure called the central line, which is a line that goes in the neck to help you breathe in a life
Hmm.
threatening situation. You're going to do it 5 times on Vantari's platform in virtual reality in a safe way. It's going to guide you, it's going to score you, and at the end, it's going to tell you how you perform. If you get 100% on 5 goes, you can now move on to a supervised session either on a mannequin or on a patient. And so that's great because you're getting both of those pieces together to make you the ultimate, practitioner when you're going to go and deliver that care. So I think there's a bit of change management, which is always hard with healthcare because when they're doing things and implementing things, they're scared to change the way that we're doing it. And finally, Ryan, the third biggest thing is haptics, which is that people are like, well, virtual reality, you're in a headset, but you're using your hands, but you're using hand pieces and you're not holding a piece of equipment. Like I'm not holding a camera or a scope or a catheter. How do you get the feel? How do you get the tactile sense? How do I give you that when you're finally going to make a cut on the neck on a patient? How do you mimic that as closely as possible? So a lot of companies are working on haptic gloves, right? So I can wear these gloves and I can feel the tactile sense and the resistance and all the rest. And it's still evolving and it's not quite there. So what we've done is build in vibration sensors so it feels like you're going through, muscle or tissues. But ultimately, that's where one of the limitation lies. So what we say is, and a lot of literature shows this, is that for procedures, about 70 to 80% is cognitive load. Like it's almost like the flight checklist, Ryan. Like what are the steps? What do I do if something goes wrong? If I make a mistake here, I hit the artery, what should I do? Right? What are the red flag events and so on? That's what VR does really well. Decision trees, saving you don't have any equipment, so the consumables are gone. You can practice to your heart's content. That's where it's great. Whereas the final 20%, the final feel, touch, that's still evolving, but we all know nothing is as good as like finally doing it on a patient. I mean, I don't want to use this analogy, but let's just say you're a cook or a chef, right? You can only practice in VR so much before you have to actually go do the dish. So
Yep.
I think wherever you can bridge that gap with traditional simulation in VR, you'd get to a much better healthcare practitioner. So yeah, those are the three big things.
That's crazy. So I mean, that was my one of my big questions was from the standpoint of obviously doing it in video with the hand pieces, but that lack of physical touch, right? And the sensory side of it. So I mean, so you guys are using gloves with like vibrations and everything else to just as closely simulate that feel and that touch, that sensory side. That's amazing. Man, okay. Let's see here. Sure. Like I said, we've covered so much of this. This has been so good, man.
No
Um,
worries.
alright. Okay, this is good. So which healthcare leaders organizations are most at risk if they do not modernize their training approach? Essentially, what's going to happen and do you see this happening? I know we talked about pushback and hurdles and stuff, but do you see some organizations, some types of like medical um like some areas of medicine where there is more pushback than others, and then from because of that you just know for a fact they're just not going to modernize and they're not going to be essentially just increasing from the standpoint of progression, right? I mean, do you see that happening?
Yeah, definitely. I think, it's a slow burn in a way, but the more and more the tier one organizations start to use it, the more it's disseminated. So what I mean by that is, we have about 50 institutions and partners that use our platform globally right now, which is great. So if someone wants to start tomorrow, I can just refer you to any one of those 50, right? And so what we're seeing is that because institutions like Harvard, Yale, Hopkins, Mount Sinai, Henry Ford Health, NYU Langone, like the big ones, are using our platform and starting to integrate it, it becomes a lot easier for those who are on the fence or those who are averse to starting to use our platform. Now, there is also financial constraints and budgetary constraints, right, in terms of procuring resources for your hospital. But ultimately, if your litigation is so high or your, healthcare burden is so high because, people in hospital are not turning over or they're having more infection rates and staff are getting sick, like it's it's like horses for courses. It's worth the investment, right? And so I'd say I saw this a really good example of this is in surgery, Ryan, where when you used to do surgery, it was just open surgery. Okay. So we would just come in and we do an open operation overview. But so let's just use the appendix if you know it's just on your right lower
Hmm.
quadrant there. But let's say it gets inflamed, you come in, we used to do an open operation, make a cut and take it out.
Hmm.
Then it evolved to using laparoscopic surgery. So you would use cameras to basically help remove the appendix. But what that would do is help you actually get a chance to go home the next day without having to stay in hospital. Because when you do an open operation, it's a bigger cut, it's more pain, you need more analgesia, all the rest. Now, where it's evolved to in the last 10 years is robotics, right? So we've seen a change from open to lap to robotics. And so not everyone has a robot in their hospital, but those that do are getting more surgeries done, getting more efficient surgeries done, having less complications, getting better patient care, better patient turnover, and having a better bottom line for the health exec. So it is the same, I guess, analogy for virtual reality and Vantari, because those that are using it are going to start seeing the benefits. We're also using, which is always a big thing in healthcare, which is evidence based medicine, right? The more research you show for your platform, for your technology, for your tool, the more it's going to be used. So we have data now that's shown that our platform reduces medical error by 40%, which is massive. It
Huge.
improves performance by 30%, improves safety and hygiene adherence by 32%. So like all those key metrics that people look for when they're making a big decision to roll it out. So I'd say there is still probably sites that, one, it's an affordability issue. Two, it's like, let me wait and see because I'm just a follower site. It's often like um, very geographically based as well, Ryan. Like, where I'm from in Australia, like we just tend to be more followers. So we'll see what the US is doing, the UK is doing, and say, hey, like maybe in a few years we'll get it. But ultimately we'll get it, but we're just a bit more cautious. So whereas you look at the US, and I'd say the East Coast is even faster than the West Coast, in all honesty, from what I've seen. But there are the innovators who just want to say, you know what, we're the first ones to use it. We want to make the groundbreaking research. We want to launch. Then there's like kind of the middle ground, which is like, hey, once you've shown some early data points, let me start. I'm happy to come on. And then you've just got the laggards, which will come on in 5, 10 years. But you know that it's part and parcel, right, of technology and a new use case. Yeah.
Yeah, that's so good. And the fact so you said you guys are working with 50 50 partners right now, and that's globally, correct?
Yeah. So we've got like hospitals in the US. We've got hospitals in the UK, actually in Europe as well, in Italy, out of all places. And
Wow.
then we've got institutions and hospitals in Australia as well. The other part of what we do is, Ryan, we actually have our platforms accredited by the college and also through our industry partners, which is that you can claim CME, CPD on our platform. So through the anesthesia college, through the emergency colleges in Australia, you can claim points for practicing because you have to maintain your credentialing. And then we also have, accrediting partners with Intellios, which is the world's largest ultrasound accreditation body. They accredit about 150,000 practitioners yearly, sonographers, physicians, in certificates to do with point of care ultrasound. So what that generally means is instead of having to go to a testing center and get your certificate, you can jump in virtual reality and get your certificate that way as well. So there's that branch. And the last thing I probably provide here, Ryan, which we didn't get into too much, which is totally fine, is that when you're in virtual reality, when you're immersed, is like you're actually using medical equipment, right? If I can just let you picture this for a second, if you're in the headset, you're in an operating theater, you've got equipment, you've got ultrasound, you've got a patient. Now, these equipment, they're actually one-to-one digital replicas of real life equipment. So we actually work with, these manufacturers, so Boston Scientific, Edwards Life Sciences, J&J, Fujifilm, Sonosite, to build digital replicas of their equipment so they behave exactly like they would in real life, if that makes sense. So that's part of our 50, in that we actually have these really big partnerships that allow us to scale, but also bring in exact equipment so that when you're practicing, Ryan, or anyone is listening here, you're actually using the exact equipment you would use at your hospital site.
So impressive. Last one do you mind one more question? And
Yeah,
then
of
we
course.
can totally wrap this up, but this is just I'm very fascinated. Talk to me about you had said the best salespeople are like your guys' process, right? And it totally
Yeah.
makes sense. It's a personal case study or at a hospital, a branch, right? And then they're having their colleagues come in and like experiencing it. So talk to me about like what are you guys doing from any type of like an inbound lead flow? Like what about advertising? I'm assuming you go to trade shows. Tell me a little bit about how like what are you guys doing from that perspective?
Yeah. So, we are we're still in a very startup type phase, right, of our of our company. I mean, I'd say we're sort of startup to small medium enterprise almost, but you have to be super creative. But I'd say the number one lead gen that we've found, besides obviously referrals, which is a huge thing, right? I'm very grateful for it, is trade shows. So like they're massive. People are always coming to see whether it's large simulation conferences or specialty specific ones like anesthesia, ICU, emergency medicine, cardiology. We might even partner with some of those medical device companies that I mentioned to be there together. So we'll be in their booth showcasing what we do, which is amazing lead gen for both. Um, for us, I think it's really just looking after like our partners, our customers, so that they, like I said, become the biggest voice for us. And so, my team is still quite small. We're sort of just under 20, but I'd say like we're 20 acting like we're 50 just because of the way that we we all wear lots of hats. But at the same time, I'm really grateful. Our first few partners in the US were Henry Ford Health and Harvard BIDMC, but between them, they actually brought on about 15 hospitals, right? And that's amazing. And I didn't have anything to do with that. They just, especially at Henry Ford with Dr. John Mitchell, and Chris Clark, they really brought on, huge foundational group of systems that acted like a VR consortium that would run research, implement our technology, and show how it was being used. So, like, I'm always grateful for it. I have one particular story I'll share here, Ryan, which it always sits with me, which is that I had a doctor do a chest drain, which is a tube that goes in your chest to help you breathe in a situation where your lung has collapsed or it has an infection, and you need to drain some of the pus out. But essentially, this person hadn't done a chest tube for very many years, and they were a senior practitioner. So I'm saying, Ryan, like kind of like 10, 12 years in, and they just hadn't had a chance in what they were doing. So he did our platform just by chance, right? He came in to a hospital back in Australia. It's called Fiona Stanley. He said, "Look, let me use it." He used it and he didn't think anything of it. He goes, "Oh, that was awesome. I really enjoyed it." Now, 1 week later, he got asked to do a chest tube on a patient.
No
And
way.
yeah, I couldn't believe it. And he did it. And he literally messaged us and he said, "Hey, Team Vantari, hey, Nish, like, I'm so glad I got to do your platform because I'd completely forgotten how to do it. And because of it, I could do this procedure well." Now, like, that just makes like everything worth, what we do, because that's exactly what we want to hear. Now, patients may never know that someone used Vantari, right? Eventually, maybe as a patient, Ryan, you'd be like, "Can you make sure they used VR or they used Vantari?" But like the patient doesn't know that, but it makes a difference to the doctor's life. And that's what I want. And so, yes, I think having these healthcare systems start to become our biggest, voice outside of our own lead gen, which is trade shows, it's just naturally leading to a lot of inbounds, which we get. And then we use platforms like HubSpot, our CRM, to funnel it all together. So, yeah,
That's awesome. Okay, that's so good. Let me just see real quick.
no worries. Hopefully that's helpful, Ryan. Yeah.
Oh, it's very good. Thank you so much, Nish. Um, so this is actually on par for where we this is still on subject where we left off here. So from a standpoint of beyond inbound, right? Like you said, trade shows,
Hmm.
um, what type of other like proactive approach, whether it's through hospitals, simulation centers, or academic programs, like what else is on the chopping block for you, or like what other kind of things are you kicking around in your guys' conversations from the standpoint of additional lead opportunities?
Yeah, so I think, look, we in the last 7 or 8 years of running the company, I've only ever engaged a PR firm maybe for a year back in Australia, but honestly, everything else has been organic. So our main channel is LinkedIn. It's just a very powerful resource for healthcare leaders and practitioners to see what's going on. So we have a huge base of support there, which is really nice. Um, X is another one, and so is Instagram in some different ways. I'd say Facebook Meta is probably the lowest of those tiers in social channels. But, for instance, when you're at a conference, you're tweeting, you're making a live suggestion, that's often powerful. And a lot of healthcare practitioners use that. So I'd say social channels are a really big one for us. Um, we also obviously rely on like really good um, inbounds or people requesting to like share our stories. So for instance, this is a great opportunity to sit here with you, Ryan, and talk about what we do. It also gets me to stop and think about what we do because it's not something I
It's
do on a daily basis. So, sharing this is also very nice. I mean, it also helps the startup, community, but it also helps us. People then can relate a face or name or the person behind the technology, right? You're not when you're buying a technology in its early stages or growth stages, you're still investing as much in the people, in their support, and how they can help you implement it. So that's important. Like now, when you buy Microsoft Word, it's not like you think about the 500 people that put it together or PowerPoint, but like when you buy Vantari, you think about the people behind it because it makes a difference and the leaders that come with it as well. So I'd say that's another point. So just making sure we share our voice, share our story as much as possible so that people know about it. And then being lucky with, or being fortunate with the media pieces as well. So we've had a few showcases on TV, on larger scale formats. And then getting a chance to present at these conferences is often good, right? Like we try not to get involved with the research because we don't want to influence it. So if the health system publishes research at a conference, we'll support it so that, for instance, they have now announced their research. Let's go and live it and let's practice it in virtual reality. So we'll have a station there to support. But for me, I may talk about, hey, how was it coming as a vendor to support this health system, make a difference? And those keynote speeches then often leads to like more inbounds as well. So yeah, I think definitely those are our biggest angles right now, and it's continuing to grow. I think eventually it'd be nice to have someone that can take our marketing to the next level. But we didn't have merch for about 7 years. Even now, I've got a very rudimentary T-shirt that I'm trying to expand on. But yeah,
there you go.
it's interesting, and I often feel it when I go to my closest coffee shop and they've already got like 3 types of sweatshirts, and I'm like, I'm so far behind.
That's hilarious. I'm in the same boat, man. That's so funny. All right,
Yeah.
let's see here. That is awesome. Okay, this is really good from the standpoint of delegation. So you said, and I love what you said earlier. I think you said you have a team of what was it, about 12 to 15 guys or people right now?
Yeah, so just under right now, I'd say probably just under 20 at the moment. Yeah, yeah,
Okay. Do you find yourself, let me just ask this appropriately. So how
that's okay.
much of your time or your leadership team's time is spent on tasks that are truly aren't strategic from the standpoint of progressing the business, right? Like building out the right like funnels and stuff. How much of your guys' time right now seems like you're still working on administrative tasks or kind of lower level tasks?
Yeah, it's funny. I call it like taking the trash can out. So like I still take the trash can out every single day. It's just part of my day, and the reason I continue to do it and I'll always do it is that it shows that no job is too small. Like, I know it means that it takes time away from more strategic tasks, but we're not at a level where we have hundreds or 300 people where you can just make a decision and maybe it will happen. But even then, I'd probably take the trash can out, but I think that's just my philosophy. But it also means that when we have young people join our team and they're excited and they want to grow, if they see leaders still doing that stuff, they're like, you know what? No small job is too small. I can do everything. And just this mentality of wearing multiple hats is super important when you're in startup land. So I'd say I'm a CEO by title, but a founder at heart. And I'll always be that because I don't care what it is, I'll do it. But it means that you have to make up the time and make sure. I'd say I'm getting better or have gotten better at time blocking, at setting up my calendar so that you specifically have set time to do more strategic tasks or thinking. So maybe in the morning after you've cranked out some important emails, you block out because that's when your mind's starting to think and use some of those creative juices to actually do that. Or we have, for instance, once a week where our leadership catches up and we do very leadership based outcomes and strategy. And so that's really important as well. And so, really, I'd say ensuring that that's part of your flow. But even today, like there are days where I'd say more than 50% is doing more operational lower level tasks. And
Hmm.
sometimes it's 100% of that day, but there are some days where it's 20%. But I'd say you have to also then ensure that you do trust the people you're bringing on. So one of the biggest, I guess, downfalls of founders or CEOs is that you tend to be like, well, I want to do everything or control everything and manage everything. And then you don't actually diversify, the information that's in your head, or like empower people to go and do the things that you want them to do. So I'd say you're hiring people for a reason, believe in them, teach them. Don't expect them to just hit the ground running. Don't even expect them to be a superstar in 3 months. You really have to guide them and get them there. And I think if you look after the person, they will really blossom. So it's something that we've learned, and we're being very smart and strategic about how we grow as a result, because I can't remember who said this. It might have been the Netflix founder who said culture eats strategy for breakfast. And I believe in taking the trash can out, and that culture eats strategy for breakfast. So those are the two things I'd share, Ryan.
Oh, that's so good. No, and that's the hardest thing about being a founder is nobody's gonna do most of the day-to-day tasks as well as yourself, right?
Yeah.
So, finding the right people to put in place, training them accordingly, and then really obviously staying on as obviously a boss, but more of a mentor, to newer hires. I know in my own business experiences, the hardest thing has been hiring, training, and then maintaining, right? Like, hiring
Yeah.
is easy, training
Yeah.
somebody is easy kind of, but
Yeah.
maintaining and
Yeah.
helping people improve on a day to day is very difficult.
Yeah.
Uh,
Look, I was going to say quickly, Ryan, there, like maintaining people is so important, because like productivity changes, life situation changes. Maybe you have a family, maybe there's illnesses that come up, maybe the passion's not as there as it first was. Maybe things are hard in the company that you can't get remunerated as much as you want. Like there's so many reasons why people's productivity may change or passion may change. But I think it's really important that you, it works both ways. Like they keep you accountable, you keep them accountable, and you help each other and you get there, right? But I totally agree. It needs constant work and effort. And someone once said the hardest part of scaling a company or even starting a company is people management, and I still think that is one of the hardest things you can ever do in anything. Like the start's the easiest. You're in a basement, and yeah, it's low risk, and
yeah,
you're trying to dream of this unicorn, and you're like, oh yeah, what's my brand gonna look like? What's the name of my company? That's like naming a baby. That's like you know
yeah,
very infant type problems, and then you scale a company. You're worried about your taxes and people's livelihoods, and making sure that they're productive, and you're getting shareholder return and raising institutional capital. Like it's just mind boggling in terms of that. But I think know your strengths and weaknesses as well as a founder, as a leader, and make sure you rely or empower others to help you. So I'm really good in that. I know what my strengths and weaknesses are, that my co-founder, who's a physician but has very different skill sets to me, it gets, he gets to work much closer to the product, where I work more on commercial, because we know that that's where, our strengths kind of lie. And then with technical, like it's not like I can code. So I am heavily reliant on our CTO and co-founder in that way as well. And then, yeah. So I think slowly uh, getting people to grow to the way that you want is also really important, and then maintaining them, like you said, Ryan, is absolutely crucial. It's a daily effort. Yeah.
totally. No, and just yeah, maintaining and managing is uh truer words could not have been said. I'm laughing. I'm just thinking back to instances in my businesses when you talked about that.
Yeah.
Nish, talk to me about. I know you guys are using HubSpot, like you said, as a CRM. Talk to me about any automation that you guys are using right now, either from an inbound perspective, an outbound perspective. What types of systems do you guys have in place that are either working well for you or things that you think you could improve on?
Yeah, so it's a really good question. I think, AI has just gone gangbusters in terms of like, what it's doing for the industry and the world as a whole. For us, like OpenAI, DeepSeek, all the rest, like we use it from email lead gen to funnel flow to even like proposals. We can get it proof checked or grammar checked and all the rest. I think you have to be careful that you don't rely on it so heavily that it limits your creativity and decision making. So I think there's a balanced approach there, but making sure that, like you said in the previous question, what are some of the lower level tasks or more rudimentary tasks, or what I call trash can tasks, that
Right.
something like AI can help you with, right? So I think there are definitely things there that you don't have to repeat. We used to set up email drafts on HubSpot, but maybe the way it's set up and the way it's aligned to, for example, Ryan, I'm going to send out um, a uh, a marketing template or a content newsletter to 3 parts of the globe. Well, how do I know what time is the best time to send it? When do people open it? If they're a doctor, what time would they have on their schedule depending on their specialty? Well, something like OpenAI or ChatGPT can give me that information. Hey, if you send it between 11 a.m. to 1 p.m. on a Wednesday, when they're in the US, that's when they have their coffee break and they'll have a chance to read it. Like, that's an example of how you can automate and make it efficient. So that's one. The second thing is on the coding side, we're seeing that it's the same thing, right? There might be some high level code versus rudimentary code. So, like our CTO is a big advocate of AI and has been using things like Copilot to help with coding queries with general chat. He's been using N89 for automating some of the bug triaging. So, like, let's just say you're getting a huge influx of issues or bugs. Well, how do you triage them? How do I know, Ryan, what you're telling me is the most important versus John Mitchell or Henry Ford versus Harvard versus Yale? Like, how do I prioritize? So that's something you can automate as well instead of having a person at Vantari channeling through hundreds of bugs.
Yeah,
Um, Maybe you're summarizing papers, use something like Google Notebook with the LM. So if you use the LLM, it will actually help you summarize those research papers and actually help you focus on the ones you want to do. Maybe you're using Gemini, for instance, for transcripts. I don't know what you're using for this, Ryan, but we use Gemini for our transcripts or for general chat. So yeah, I think there is huge layers here. And, for us, our management system that we use on the back end is not just AWS Cloud, but also the Atlassian suite. So we use Atlassian Crucible to act like a reviewer of the code. So let's say we've done all our coding, but we need like a fact check or a quality assurance check. Well, hey, we can use AI for that as well. So that's a huge array of ways we're using AI, from the technology aspect to the operational aspect to the commercial aspect to the even the customer aspect. Yeah.
that's so good. Do you guys, very specifically, do you guys have any, because I'm learning more about this too. You guys have anybody in or anything in place from an AI agent perspective that's handling like basically all of your SDR, any of like your actual outbound calls, and even the you had mentioned you guys from seminars and stuff get a lot of inbound calls now. Do you guys have any type of AI automation handling really like the conversational side of it, not just via email campaigns,
Uh,
via SMS text?
That's a good point. I mean, um, we probably should pick one pretty soon. I mean, we've been playing with a few, but I haven't. It still hasn't been totally automated, if I'm being honest. And I think that's just the personal touch side. And I still answer all of our inbounds. It doesn't mean after this podcast everyone starts sending me something, but I still, for the last 8 years, have answered every inbound that's ever come into the company. So I do think there's a time where it changes and you have to use the right tool, but I have seen AI agents or even AI EAs work for leaders. So often you'll think you're talking to someone, but really it'll be Grace or someone, but that's just an AI agent's name. So I do think that it's is definitely something that will become more normalized, where Ryan, your AI agent will be talking to my AI agent, matching up our calendars to make something like this happen, and potentially they start sharing information about each other, like, hey, Nish likes a daytime meeting versus a nighttime meeting. Or actually, Ryan's actually prefers to do a recording at this time. So yeah, I think it starts to become part of your personality, but we don't have anything implemented completely, in all honesty, on that side, but it is something we're testing and playing with. Yeah.
Awesome. Perfect. All right. Let me see. Okay. Last question. And I think this is going to be a really good one. So if you guys, obviously as a company, so Ventari VR, if you guys were operating at a 2 to 3x scale over the next few years, what type of automations and systems would you guys need? And you guys were at the same, let's say you guys were at the same headcount and you didn't scale from a personnel perspective, but you guys were trying to grow the company and the revenue by 2 to 3x. What do you think you'd have to do and implement in order to do that over the next few years? So that's question number one. And question number two, where do you guys see with your existing growth trajectory? I mean, where do you guys see yourselves from the standpoint of where you were 2 years ago versus where you are today versus where you guys are headed and where you guys want to go?
Yeah. So that's two really good questions that I'll try and wrap up in together in the one response. But when you think about traditional hiring, you say, well, okay, my revenue is growing, my partners are growing, my my business is growing, right, year to year. And you think about what are the resources you need. Now, back in the day, you just think about personnel resources, right? Of course, you think about software, but you think more about personnel. Look, I need to have more people on the ground selling. I need more people on the ground handling the clients or servicing them and supporting them, right? Maybe now I've grown so big, I need a much bigger legal counsel or a tax counsel to handle my taxes in multiple countries and so on. So I would say the biggest thing that I've seen in us is that in by launching in the US about 2 and a bit years ago, like our whole company grew by like almost 400%, right? It was crazy because we only have had 10 hospitals in Australia over the first 5 years of launching. And there was obviously huge movement after the pandemic because everyone wanted to virtualize it. So there was a huge hype cycle. Everyone's like, oh my God, like can't run workshops, can't be in hospital. We can't have people in the same room. We need VR. We need it today, right? Like we need it urgently. So that was a bit of a macro shift, but I'd say launching in the US, just because it's a privatized healthcare system, there is more litigation. It's also there's a lot more people and a lot more volume of surgeries and mistakes that can happen. It just seemed like a natural fit, right? So we went from like 10 to 50 in the last couple of years, which is mayhem because you really think about the velocity of growth. But
Hmm.
I'd say the thing that's always on my mind is one is content, Ryan. Like, we have about 50 modules or content training procedures, high fidelity simulations on our platform, but it doesn't cover all of the procedures, all of the scenarios, all of the complications that can occur in the specialties we work with, right? Like, for instance, you should be able to, what I'd ideally like to get to, and this is the future concept, is that you get to practice on the exact patient that's coming in virtual reality before you get to do it on that patient. Does that make sense? So I get
Yes.
to practice on exactly Ryan, exactly his, you know, uh, body habitus, his age, his comorbidities, or any other conditions he has. And I'm going to do that exact procedure in VR. It's going to run me through, and then I'm going to make sure I'm 100% competent, and then I'm going to go to Ryan. I'm going to practice on Ryan in VR. I'm going to do it on Ryan in real life. That's where I want the holy grail to be. And honestly, that's either going to happen with us or as the technology matures, or it's that the technology gets so good that, Ryan, you get to practice, I get to practice at home before I even come to the hospital. Even better, right? Like I'm sitting in my living room, I've just had dinner. I'm like, okay, I've got a case tomorrow. It's going to be Ryan coming in. Hey, let me just load up Ryan's data set. Let me look at his EMR patient records. Okay, let me now do this procedure and potentially, hey, I'm getting stuck. Let me call someone in. Someone dials in to the same VR environment and we're going to do it together. So that's kind of where I'm seeing the future evolution of what we're doing in from VR to mixed reality to patient specific, procedures. And so when I'm
That's
thinking about
crazy.
when I'm thinking about how to get there, I think what I need to always have an eye on as a leader is like, you know, as our technology becomes more and more favorable, much more applicable, is better research, it's how do you manage and support the infrastructure that you've set up? So more than selling, it becomes the customer service and support side, right? Making sure it's integrated into health systems well, making sure that when there's queries about your technology, you're there for standby support. So that piece becomes really important. Maybe an AI agent can cover 50% of that work because it's common queries about, hey, my headset's gone down, it's not working, or actually you haven't charged it, or something basic like that, right? All the way to actually you're not my login's not working right now. Is it expired? Right. So I do see a huge ability for AI to help with that and deal with the customer support side. And I think getting that piece sorted will help us automate a lot of what we do right now because we're still hand holding people through the process. What about, Ryan, if you're a new customer next year and you're the 51st customer, you're going to need what the other 50 customers had too, right? Like you're going to need a day of onboarding, learning the technology. What if AI could help you virtually or in person onboard you 80% of the way, and then we really only have to handhold the last 20%? So there are ways that I think these tools can really help offset the number of personnel resources you have to have as the company so that you don't suddenly have to go from, let's just say we get to 100 partners by the end of next year. It means
Hmm.
that instead of going to like 30, 35 personnel, maybe you can go to 25 personnel or 28 personnel. Like you can reduce your headcount and operational expenditure and those big costs that really drag you down as a company, and help
Hmm.
maintain it through these, like, large language models or softwares that can support it. So I'd say
It's so
we're still figuring those parts out, but that's where I see the operational infrastructure side and support side. You can definitely do a lot better to help you scale, because at the start it only helps you X amount, but as you're scaling, you can really add value using AI.
so good. That's awesome. Well, Nish, thank you so much. This has been so incredible, very eye opening. Is there anything else that you want to tell our listeners about yourself or your company? And lastly, if you would finish off with where can people find more information about you? That would be awesome.
Thanks, Ryan. Thanks everyone for listening. I don't have much else to share. If you made it through all of this, it means that you're really interested. So I appreciate you, and you can always
As they
reach
should.
out through. Yeah. Um, and hopefully, we're making a difference every day. And one day, when you're at a hospital, you can ask them if they use Vantari. But if you want to reach out to us, just reach out through our website, www.vantarivr.com, which is Vantari VR.com. I'll share one thing that our listeners might not know. Actually, a lot of people might not know is the company is called Vantari for a reason. You might think it sounds really futuristic and it's something from like an aliens movie, but it's not. It is actually from a spiritual side. So, I'm a Hindu by background or religion, and in Hinduism, the physician of the gods or the doctor of the gods, his name was Dan Vantari or Dan Vantari, and Vantari is part of his name. So when you're using Vantari, you're using the physician of the gods. So hey, that's always nice.
That is very cool. I love it.
Cool.
That's awesome, man. Well, again, thank you so
Thank you.
much. And yes, we'd love to follow up and talk to you soon.
Thank you, Ryan. Thanks, everyone. Appreciate it.
All right.